In your health headlines, in light of Tiger Woods' arrest and subsequent blaming on prescription pills for his DUI, we wanted to take a closer look at possible reactions to some of these strong medications prescribed by doctors. Dr. Mitchell Goldman with UCSD is here with us now to help us sort it out. Thanks for being here, Dr. G.
It's good to be here, Kathleen.
Well, as you know, a DUI really used to just indicate drunk driving, but more and more we're hearing about drug driving, and it's not just illegal narcotics. You say there are a lot of medications that don't mix with driving.
There really are, and driving under the influence means the influence of anything that can impair your ability to drive. Now, almost all of us know that if you have an alcohol level that's extreme, you're going to be impaired. But what people don't realize is that many, not only prescription drugs, but over-the-counter drugs like Benadryl and the antihistamines can also cause drowsiness. And studies have shown that only 27% of all Americans realize that actual medications can impair driving.
And why is that, Dr. G? Is it the pharmacy's responsibility, the patient's? Is it the doctor's?
You know, it's basically all of us. Of course, common sense means that if a patient is acting more sluggish and feels like they're not all there, they should know that they should not be behind the wheel. And that's why Tiger actually pulled over, stopped, and went to sleep, which was, of course, much better than driving. But what pharmacists need to do, and what pharmacists do, is they tell the patients, and they have all these written materials about what drugs are safe and what can cause impairment. Now, the problem becomes that many people are getting prescription drugs through the mail. And if you're getting prescription drugs over the internet, those kinds of drugs like for anxiety or for pain that can really impede our ability to have quick reactions, we don't usually talk to a pharmacist because we're getting them on mail.
That's a really good point, but also using more than one medication is a situation a lot of people are experiencing as well, and that can be a dangerous cocktail, and we don't know how they intersect.
You know, absolutely, Kathleen, and that's why what people should do is when you're taking any medication, whether it's an over-the-counter, whether it's an herbal medicine that you think is safe, or of course a prescription medicine, before you get behind the wheel, take the medication, sort of see how you feel. If you feel tired, if you feel a little sluggish, if you feel like you're not reacting, that's when you need to actually go not behind the wheel. So things like sleepiness, blurred vision, dizziness, those are things that we can tell by ourselves that we shouldn't be behind the wheel. Because when we get behind the car, we have to realize that a car is like a lethal weapon. It's a few tons of material that goes at speed. And the last thing you want to do is not only hit another car, but God forbid hit a pedestrian or a cyclist, because then you're causing lots of bodily injury, and you don't want that to happen.
That's right. And also just underscoring that over-the-counter medications you're innocently taking for allergies, really read all about those side effects.
Absolutely, Kathleen.
Dr. G, thank you so much.
Good to be here.